Thank you, Jeff. Good morning, everybody. Yes, I'm Paula Grammis. I'm a professor of neurology at Texas Tech Health Sciences Center and director of the Garrison Institute on Aging. And I'd like to talk to you today about our new approach for the treatment of Alzheimer's disease. Okay, next. Alzheimer's disease, as I don't have to tell pretty much anyone these days, is a terrible disease. It's progressive, it's irreversible, it's ultimately fatal. It's a dementia, it's a loss of all cognitive function. It's a huge problem demographically. There are over 5.6 million people afflicted in the United States and over 30 million worldwide. And the estimates are really scary, about 100 million by 2050. So there's a huge push in trying to understand the disease and develop disease-modifying drugs. I'd like to say at this juncture in 2010, currently there are no disease-modifying drugs for Alzheimer's disease. There are 5 currently available FDA drugs that are used for patients that have Alzheimer's disease. But I'd like to reiterate that they are not disease-modifying drugs. They don't essentially address the basic process that goes on in the Alzheimer brain, which is nerve cell death. They modify the symptoms and are useful in patients in prolonging some quality of their life for a period certain, but they are not disease-modifying drugs, and there's a huge need to develop drugs that really address the issue of brain cell death in Alzheimer's disease. The market is huge, as of course the disease is so prevalent. $2.5 billion was spent on Aricept, which is one of the currently FDA-approved drugs. But again, I say this is not a disease-modifying drug. But this just indicates that there is a huge market. And again, the numbers are expected as the prevalence increases to increase hugely. So this is a terrible societal disease and also a huge market for drugs that will improve this condition. Now, Alzheimer's disease, just briefly, nerve cells in the brain die, so we know that. So the $64,000 question is why that occurs. And the reason I think today, in 2010, we have no disease-modifying drugs is that all therapies for Alzheimer's disease have been targeted and developed by focusing on the nerve cell. Although the nerve cells die, we believe that they die not because there's anything intrinsically wrong with them, but the environment in which they sit is no longer conducive to their health and well-being. And our efforts have focused in a novel direction by looking at the blood vessels in the brain as really the cause of what sets the process for nerve cell death. The brain, as this cast shows you here, this is a cast of blood vessels in the brain, is a highly vascularized organ. Although it only weighs 2% of total body weight, it gets over 20% of the cardiac output. There are over 400 miles of blood vessels in the brain. So the blood vessel function and well-being is very intimately linked to nerve cells. So we've said, well, we think in Alzheimer's disease, although the nerve cells ultimately die, the process that initiates it and controls it occurs at the level of the blood vessel. So we believe that there is activation of these blood vessels, and this is based on about 25 years of work looking at isolated blood vessels from Alzheimer's brains and using a technology we developed many years ago. We've been able to show that these vessels are activated and produce proteins and other factors that we believe can kill nerve cells. So we've asked the question, if we could intervene and stop this vascular activation, could we improve the picture in Alzheimer's disease? And ultimately, Alzheimer's disease is a disease that begins with memory dysfunction. Loss of memory is an indicator of nerve cell dysfunction and death. So we tested our idea in an animal model of Alzheimer's disease. You may know that there are some genetically modified rodents that experience something like Alzheimer's disease, although not the complete pattern of the disease. One of the things that they do show is memory loss. So we were able to test our ideas in these mice to say, if vascular activation, blood vessel dysfunction is at the heart of this disease, if we treat these animals with a vascular inhibitor, can we make memory function better? And that's what's shown in this slide. Rodents are very good at these behavioral tasks. They are trained to retrieve food. And normally they can be trained, and then you go back a period later and you test their memory. And normal rodents are very good in an 8-arm maze. 8 is essentially a perfect score. They remember where the food is. These Alzheimer mice, you can train them, but then when you put them back and you test their memory at a later time, you could see in black, they really hover around 15 or 16, which in an 8-arm maze is essentially random entry. They don't remember where the food is. So this is our biological indicator of memory impairment. If we give the vascular activation inhibitor to these animals and we take it out to about 20 weeks, we've actually taken that a little bit further now, we can restore their cognitive or their memory function. So we think this initial animal data is hugely supportive of our hypothesis that vascular activation is really at the heart of the process that's driving nerve cell death, which again, nerve cell death is really the underlying cause of Alzheimer's disease. So our project goal is to use this concept of vascular activation inhibitors to treat Alzheimer's disease. To date, our milestones completed is we have a patent that's been filed for this idea of using endothelial interrupters or activation inhibitors for the treatment of Alzheimer's disease. I've shown you some of the data that we have using this initial drug that we've screened, a Pfizer drug. These drugs, I should mention, these vascular activation inhibitors have been developed for cancer treatment, so they have gone through phase 1 and phase 2 in humans, but they've never been looked at in Alzheimer's disease because people haven't approached it from this perspective. So we believe that actually getting into a clinical trial would be a much expedited time frame. This is what we've accomplished so far, in addition to some in vitro work, which I really don't have the time to show you. The milestones to be completed, in my opinion, to make the case really compelling, we have to continue and test multiple drugs that have related mechanisms of actions at the level of the blood vessel, which I think will take about 2 years. And then a pilot clinical trial to just assess efficacy and safety in Alzheimer's patients, I think, could be accomplished in about 3 years. And we think at the end of that time frame, we will have a new viable treatment for Alzheimer's disease. The scientific infrastructure is all present at Texas Tech Health Sciences Center. I've been doing this a long time, and we have the laboratory and the personnel trained and capable of performing the animal experiments, working with the commercialization office to be at places like this and meet folks like you. What we need is our partners in the business end of this, either to work with us for licensing the patent or to be partners in a startup company. I think this is a hugely terrible disease. There's a big market for drugs. It's an opportunity to do well by doing good. So we are hoping to interest some of you in the technology that we've developed. Thank you very much for your time.